Well, hello and welcome to today's discussion. I'm Dr. Denise Thornley Brown. I'm a professor emerita at UAB and a practicing nephrologist. I'll be the moderator of today's session. Joining us today are two distinguished professors from UAB, Dr. Carlton Young, professor of surgery, and Dr. Vinita Kumar, professor of nephrology. Both are very active in the transplant program at UAB, and I was really delighted when they agreed to be on this panel. So let's get started. I'd like to know a little bit about who you are, what got you interested in becoming a transplant physician, and what kind of training you needed. So most people know about surgeons, so why don't we start with you, Dr. Young?
Oh, start me. I guess anyone who goes into medicine has a long journey. My journey started in Philadelphia, Pennsylvania, where I grew up. Went to Villanova University, then to Johns Hopkins for medical school, then back to Philadelphia residency. And then what surgeons do is after they finish their general surgery, if they want to do a specialty, they then go do extra years. That could be 2 to 5 years after that, 5 or 6 years. So I spent another 2 years at the University of Wisconsin, and I finished in 1995, and then went to University of Arizona for a couple of years, and I've been at UAB since 1997. And once I got here, I continued to try to get the pancreas program going, and later on, as well as be part of the kidney program. And then in 2012, I started taking over the pediatric kidney transplant program. And during that time, also doing vascular access for dialysis patients, and also working with the organ center to procure organs for our recipients. I'm sure Dr. Kumar is going to talk about some of the numbers, but the African American community and Hispanic community are disproportionately affected by kidney disease. And therefore, that's one reason we're having this discussion, let them know how important it is about organ donation. But my journey's been long, but we've been able to help a lot of people, and I've just been blessed to be able to do what I do.
And we've been blessed to have you. So Dr. Kumar, the same question. And also, what is a nephrologist? I go so many places when I meet people and they ask me what I do and I say I'm a physician. They say, what's your specialty? I say I'm a nephrologist. And I get these blank stares. So
what does that mean?
Why don't you talk about how you got here, what a nephrologist is, and what you're doing these days?
Sure. Thank you, Denise, for having us. It's a pleasure to be here. So how did I get here? Well, I grew up in India, and ever since I can remember, I wanted to be a teacher and I wanted to take care of people. I thought I was going to really be a school teacher at one point, but as I got older, the draw to actually do something more meaningful, if you will, not meaningful in terms of being directly able to impact people's life, is what led me to medicine. Went to medical school in India, came to the US right after med school, trained at University of Texas, and did general medicine for many years. But kidney disease was something that always sort of burned a fire in my belly. And that's why I went on to become a specialist in kidney disease. And what that is essentially anybody who's got knowledge of how the kidney works and trains in that is what a nephrologist is. It's very different from, say, a urologist who does all the mechanics for once the urine is made by the kidney, how does it get to the bladder? How does it get out? How can you help people? That's sort of what a surgeon in the urologic sciences will do. What a nephrologist does is, what are the diseases of the body that can affect the kidney? What are the diseases of the kidney that can affect the body? And what is the complex interplay of that with the rest of your organs in your body? That's sort of in a nutshell is a nephrologist. So nephron, the basic unit of the kidney. Logist, anybody who's got knowledge of the basic unit of the kidney. And Denise, you probably can sort of talk to this or speak to this much more eloquently than I can. But it's the physiology and the physics and the dynamics of all of that that got me really into nephrology. And I thought I was going to be a specialist in glomerular disease. And as always, it's a patient that sort of draws you into a journey that you didn't map out necessarily for yourself. For me, the journey to transplant began with when I was a fellow and I got a call at 1 o'clock in the morning, and I rolled out of bed when I was at University of Washington and went in to evaluate my very first patient was called in the middle of the night for a kidney transplant. He was 29. And I walked into the room, and he and his wife were sitting in the corner looking really apprehensive, very, very scared. And that journey that started that moment when I entered into the room has lasted until today, 14 years later. And the year that I spent with them from the day before their transplant, walking with them, talking to them about their fears, their concerns, their elation when the transplant worked, when they had an episode of rejection, helping them through, when they had complications, working with that, through their first child and their second child, and now the Christmas cards that I get every year. That entire journey to me opened my eyes into how much I'm grateful that we have modalities for patients that when they lose their original kidneys, that life doesn't end, that you can further that life by the presence of people like Dr. Young, who put that access in to help them for transplant, and then put that organ in to get them transplanted. And then it's somebody like me who comes into the picture that helps with some degree of the matching and the immunosuppression. And how do you live with that transplant long term? So, Denise, I hope that answers the question you're asking.
It really does. And, you two are both very important parts of the transplant team. And it's a team of people, not only physicians, but other members of the team as well. Do you want to talk a little bit about some of the other members of the team?
Absolutely. There is no other field in medicine, I feel, compared to transplant that is an ultimate team sport. For every one transplant that happens on the front end, there are probably 100 people working on the back end and at least 10 different specialties coming together to make that happen. So who is this group of people that we think about as the team that makes it happen? It is the entire nursing team from pre-transplant to the peri-transplant. It is the coordinators, it is our support staff and our administrative staff that help get all the information put together. It's our nephrology, general nephrology colleagues, and they are the ones that send us the patient and help us make sure that the patients are ready for transplant. Then it is our clinic staff, our surgeons, the surgical support, the operating room, the lab personnel, the tissue matching HLA personnel, the people that work in the middle of the night, middle of the day. Everybody comes together to make that one transplant happen. And this happens every day, every night, every weekend, 365 days of the year. And it does not happen because of one person. It is truly a team sport. And it's a group of people who are vested, who are working beyond just themselves to make this happen. And this is what makes it a joy to do what I do.
Any other comments, Dr. Young?
I think she absolutely summarized it perfectly. All of us have our own special areas within transplant, but no one small group of people can take care of the transplant patient in its entirety. There's just no way that I have all the knowledge to take care of all the intricacies of a rejection and all those other nuances, which are indicative of what comes along with being a nephrologist. I'm not a nephrologist. And therefore, we need the nephrologist and the team, the pharmacists, everybody to make this work. But we all do this because we care about patients. And transplant is extremely complicated with the medications we give. The patients that we have to deal with are oftentimes very ill. They can have heart disease, diabetes. So our medicine docs are truly well versed in all of the organ systems that the kidney can affect. And again, it takes all of us together to make us have good outcomes. And we're very fortunate in UAB to have such excellent and dedicated people that are committed to doing that.
Absolutely.
Please.
Yes.
If I may add one more thing, and that is that none of this is possible without another huge part of this, which is the organ center, that also equally works day and night, and all the support staff and the coordinators that work with the organ center to make these happen. The organ center we're referring to is really Legacy of Hope, who is today hosting this session. So
Yes.
Mhm.
Yes. It used to be called the Alabama Organ Center, and the name has been changed to Legacy of Hope.
Mhm.
Right.
It's a good name because it does provide hope for a lot of people. So August is National Minority Donor Awareness Month. And Dr. Young, you had alluded to the need for more minority donors. Do you want to expand on that a little bit more?
Yeah, sure. Ever since I got to Alabama, I've been involved in trying to increase the awareness of the need for organ donations among the minority community. It has been an uphill battle, but the Legacy of Hope has done an excellent job, and they've committed resources to education. Given the issues that we've had in Alabama with Tuskegee experiment, with syphilis, as well as other animosities that the minority community may have toward medicine in general, there are a lot of misconceptions that are evident in a lot of minority communities. A lot of them believe that, well, if I sign my organ donor card, the doctors aren't going to take care of me. They just want to take my organs. They're not going to do the best they can to care for me. That's not true. I'm there. I see it. The Legacy of Hope will only approach a family if after everything has been done, period. As physicians, we have a responsibility to make sure that everything is done for that patient, regardless of where they come from. And sometimes there are just injuries that are unrecoverable. And it's our hope in what we do that we can turn a tragedy into something positive. And so it's a lot of new ideas and ways to approach people have come up. But the biggest thing is education, making sure that the community understands that we are going to take care of their loved ones to the best of our ability. But if it becomes hopeless, then they're certainly going to approach them to ask them for that donation. But people should think about this when they go get this driver's license, even before, God forbid, something like this happens, but have discussions. And I'm sure the Legacy of Hope will be open. If you have questions, call them. There are people there that can answer questions that you might have. But I am here to dispel the myth that if you sign your organ donor card, they're just going to take your organs. Because I know there are a lot of people out there who have someone waiting for a kidney. It's endemic in the African American community. So if you have someone waiting, I'm sure you would want somebody else to donate their organs so your loved one could have a shot at a normal life, as Dr. Kumar discussed. But if we don't have people coming together to help us do that, then folks are going to end up waiting longer. And if they wait longer, then there's a greater chance that they're going to die waiting for an organ.
Yes. Yes. And can either one of you address this whole question of brain death? Because obviously a kidney's not recovered, organs are not recovered until someone has been declared brain dead. What does that mean? And what's that process?
I guess the one way that I always describe it is if someone sprains their ankle swells. Okay, your ankle gets big, you have to put ice on it. But if you think about it, there's nothing surrounding your ankle but air. Okay, so it can get as big as however big it can get. But if your brain gets injured, it swells as well. But the problem is it's stuck in your skull and the bone won't move. So what happens, the swelling continues and continues and continues until the pressure inside the skull is higher than what your heart can generate. So let's say your blood pressure is 120, 130, but the pressure inside your head is 200. There's no way that your heart trying to push up at 120 is going to get into your brain at 200. So same idea, that there's only the blood can only get so high. And if the blood can't get to the brain, it doesn't have any oxygen, and the cells will die. And if the cells die, they aren't going to come back. And that's truly what brain death is, that there's so much swelling and injury such that the brain does not have adequate blood flow, and therefore it dies. And we're able to keep people's hearts going for a while, not indefinitely, because all these chemicals get released, and eventually the body will just break down no matter how. You just can't keep someone on a ventilator forever. But the entire idea is that brain death is where the brain dies, where it just doesn't get enough oxygen, not enough blood, and the flow stops. Or you can have an injury that's so bad that you just can't recover from it.
So those people would be potential organ donors.
They can too. It's a different type of organ donation where you have to wait for the heart to stop. That's a different type. But again, in either instance where you wait for the heart to stop or where the brain is just unrecoverable, it just a massive injury, or you truly had brain death, then you can recover the organs. They're different things. But in either instance, that person has gotten to the point where they're no longer that person. They are dead, that if they're taken off the ventilator, they will stop breathing.
So Dr. Young, how does someone become, there are different types of donors. There are deceased donors and living donors. How does someone go about becoming a deceased donor? What's the process? I want to give a kidney, I'm alive, but if something were to happen to me, how can I guarantee that I would be an organ donor?
The two things: one, get the little heart on your organ donor card. The other thing is to tell your family that this is what your wishes are.
And why is it important that you let your family know?
Because even though in the state it's legally your right to do that, the Legacy of Hope will listen to folks. But the best way to educate your family, to let them know, is to tell them what your wishes are. Because if that's what you want to do, you don't want somebody in your family causing a big stink and complain and override what your final wishes are, just because they don't understand what you wanted done. But the best way is to speak to them, but because you might end up changing their minds as well.
Mm-hmm. Yeah, and when you're in a very, very stressful situation, it's sometimes very hard to make decisions. And so knowing in advance what your loved one would want would probably be very, very, very helpful. And that heart goes on your driver's license. Right. So yeah, when you go for your driver's license, they often ask, do you want to be an organ donor? And they can put, I have that heart on my driver's license. And so that can be very helpful.
I think, Dr. Brown, the point that you made was absolutely vital, is if you don't have that heart on your card, or if you haven't told your family member at the time of your death, for our family members, they are grieving, they are in pain, and they are not in a position to process and talk about donation, about thinking, because they immediately have a visceral reaction to what donation means. They're going to cut my loved one open and take the organs. So that is why it's so important to have that conversation before the time has come, so you can actually have a rational discussion and not have it at the height of your pain. So thank you for bringing that up. That was very valuable.
And before we move on to living donation, I just want to point out that even if you are an organ donor, you can still have an open casket.
Oh.
Yes, absolutely.
Yeah, that's important to know. So
yes.
If you want an open casket, you can still be an organ donor.
Oh, absolutely, yes.
Absolutely. Well, we're very cognizant of that during the organ donation process, that we make sure that the incision that we make is as low as we can on the chest, especially for women, to make sure that they want to wear a dress, they can place them in that. So yes, and we're very respectful, because we understand what a great gift this is for the people. We always have a moment of silence before we proceed, because it's a big deal for that family to donate, and what these organs potentially do to help someone else's life. And both Dr. Kumar and I have patients that have been out 20 years or more. We have patients probably 30, 40 years that otherwise would have been dead if they had not gotten an organ transplant. So I can't emphasize how much it's important to be able to try to change someone's life tremendously. Not only that, but also change the family's life. We get lots of thank yous from people who have been able to see their children graduate from high school, college, and are now our grandparents because they were able to get a transplant, that otherwise they would have been gone and not been able to experience that. And the fact that they're around impacts their family as well, that they were there to be there for them. So It's not only that we're treating the patient, we're really treating the entire family. If you think about it, all the time that it takes to get up, go to the doctors, go to dialysis 3 days a week, or doing peritoneal dialysis, which is a great modality as well, it takes a lot of time. And even though there are a lot of medicines with transplantation, it's a heck of a lot better than having to do dialysis, without a doubt.
Yeah, absolutely. The legacy of hope is legacy of hope and joy and health and life that is giving beyond the moment.
Yeah.
Absolutely.
And, I take care of a lot of dialysis patients. And from the perspective of people who've been on the list, I mean, I had a patient who waited 13 years to get a kidney.
Oh, that is just too long. Should not be the case.
When he got the kidney, needless to say, it was one of the best days of his life.
Yeah.